Hi everyone, it's Dr. Aman here. So today we'll be talking about anemia in pregnancy. So from our previous video, I talked about the meaning of anemia in pregnancy, the causes, the symptoms. So today I'll be talking about the complication, the prevention, the investigation, the treatment. So about the complication simply means what usually happens when this anemia is not being treated. The first thing that will happen in mothers is that there will be preterm labor. This patient, this pregnant woman will be having um she will be in labor before the time that she's supposed to give birth. She could also have postpartum hemorrhage, which is severe bleeding after giving birth. Another thing is that she could have puerperal sepsis, which is infection after giving birth, because the blood supply, like the blood, is very low, and this could cause her to have infection quickly because our immune system is actually low because of the red blood cell is the blood actually is low. So another thing that could happen is there could be cardiac failure. Yes, cardiac failure, because there's anemia and the heart is not able to pump blood very well because there's shortage of blood in the body. So there could be cardiac failure, which could easily lead to increase in maternal mortality, that is death in pregnant women. So in babies, in fetus, what could actually happen in the uterus is that there could be the baby can have low birth weight, like the weight will not be in line with the estimated gestational age, that is the EGA, the amount of weeks the pregnancy is, it could not tally with it. Another thing is intrauterine growth restriction. The baby will be small, baby will be confined, baby will be small in the uterus. Another thing is there could be preterm delivery. The time that the baby is supposed to come out, it can be shortened. So that is what we call preterm delivery. Another thing is stillbirth, when the baby is out and baby can easily give up the ghost after birth. Another thing is neonatal anemia. The baby, when it's out, can actually have decrease in blood level, which is called neonatal anemia. So about the prevention, the prevention, if it's mild to moderate, the thing that you could actually do to help this anemia, like to help in to reduce this anemia, is that you should eat a lot of food like green leafy vegetable, red meat, liver, egg, beans, things like that. And you can eat chicken, fish. Fish are mentioned. There are a lot of food that you can actually eat to meet up with this iron, vitamins, and folate in your meals. Another thing that you can do is that, where this is where your antenatal comes in. The drugs that you are given, especially the iron supplements, the folic acid, the vitamin B12, and the vitamin C. The iron is actually to help you in absorption, in creating your red blood cell. The folic acid, which you can take before getting pregnant, during pregnancy, and after delivery, is that one that will help you to combine with this iron to create more blood cells in your body, while the vitamin C actually help you to cause increase in absorption of these other drugs in order to produce more blood level in your body. Another thing that you can do to prevent this anemia from happening is that you have to go for your routine antenatal checkup, which is why every time you go for your antenatal, you are supposed to do your routine full blood count in order to check your PCV, to know the level of your blood, and also to know your hemoglobin level. You are also to do your urine test, that is your urinalysis, to check how your kidney is doing, to check if there is any glucose or protein in your urine, in order to check anything that could be causing this anemia, or that could teach you in having anemia. So another thing is, if it's severe, when you are feeling lethargic, fatigue, in severe cases, you come to see your physician in order to check any underlying causes. It's either malaria or worm infestation or any other thing that could be causing this anemia. Thank you so much for listening. Like, share, comment, follow. Bye.
Gift clinic.
Healthy baby.
Gift clinic.
Healthy mother.
Gift clinic.
Satisfied.
African death.
No more maternal death.